Hey there, and welcome to the first episode of pelvic fractures. In order to understand pelvic fractures and their classifications, first, we need to get a rough understanding of the ligaments that provides the pelvis with both rotational stability and vertical stability. Proper understanding of pelvic stability will make it easier for you to describe the type of classification when being asked either in grand round massacres or oral exams. Now let's take a look at the most important ligaments from anterior to posterior. We have the symphyseal ligaments, the sacrotuberous ligaments, the sacrospinous ligaments, and finally the posterior sacroiliac complex or the posterior tension band. The posterior sacroiliac complex is made of anterior sacroiliac ligaments, interosseous sacroiliac, posterior sacroiliac, and iliolumbar ligaments. The main ligaments that resist rotational stability, external rotation forces to be exact, can be remembered by the acronym SSI: symphyseal ligaments, sacrospinous ligaments, anterior sacroiliac ligaments, and iliolumbar ligaments. The main ligaments that resist shear forces making the pelvis vertically stable are posterior sacroiliac ligaments and sacrotuberous ligaments. Finally, the interosseous sacroiliac ligaments resist anteroposterior translation. Now, the fun part didn't begin yet. We will discuss the clinical application of what we just talked about in our next small talk. That's it for today, and as always, thanks for watching. Till next time.